Today we will be discussing about hair loss and its causes. So based on what causes hair loss, the hair loss can be permanent or it can be transient. Sometimes the hair loss may be gradual, or sometimes you may see sudden clumps of hair falling abruptly. Sometimes the hair fall happens over a certain period of time wherein you experience or see thinning. Sometimes the hair grows on its own after a certain period of time, and sometimes you might need medication, you might need treatment for the hair to grow back. However, in many cases the hair loss may be permanent, wherein you experience absolute balding, and in those cases the only thing to get your hair back is doing a hair transplant. By far the most common cause of hair loss, especially in males, is known as androgenetic alopecia. Now, what exactly is androgenetic alopecia? As the name suggests, androgen or male hormones are responsible for it. The main hormone responsible is known as dihydrotestosterone, and obviously there is also a genetic or a hereditary component responsible in this. So in this alopecia, the person starts losing hair at roughly around 20s or sometimes even in his 30s. They start gradually balding from the front, and as age progresses they go up, and the person usually loses hair from the frontal region, from the mid scalp and the vertex or the crown area. The sides and the back of the scalp, however, retain their hair, and that is how we can make sure that the person gets the absolute density back with the help of a hair transplant. In case of androgenetic alopecia, in people who have a genetic predisposition for this condition, the dihydrotestosterone hormone causes thinning or miniaturization of hair follicles from the front, the mid scalp and the crown area, and gradually over a period of time the hair thins out and finally leads to permanent baldness. So the hair from the back and the sides of the scalp do not fall off, because these hair are immune to the action of these hormones. So that is why hair from that area is known as the safe donor area or safe donor zone. Those are permanent hair and they do not fall off. So what happens is, during a hair transplant procedure, the hair from this area is harvested and it is implanted in the front, and those hair in turn are absolutely permanent and they exist for a lifetime post-transplant. You can, however, slow down or prevent the fall of the hair in case of androgenetic alopecia if you start the treatment early. You can use medicines like finasteride orally or minoxidil topically. You can use injections of PRP and growth factor, and you can also use low-level laser therapy in the form of laser combs and laser caps and use them every day. In females, the patterned alopecia is known as female pattern hair loss. However, the pattern or the areas from where the hair loss happens in female is slightly different from that in the males. They usually start losing hair from the parting, and as age progresses, they start broadening the parting. So in this condition too, like in the male pattern, we can always take hair from the back of the scalp. We can trim some area, take out hair from that area, and we can implant it, thereby covering the entire bald patch. However, in this case, the sooner you undergo a hair transplantation, the better it is. Again, you can always prevent or slow it down by using medications like minoxidil, and you can always go for PRP and growth factor as well as low-level laser therapy treatment. In general, the hair on the scalp is usually present in the growth phase or the anagen phase, and the resting or the resolution phase known as the telogen phase. Around 85 to 90% of the hair is always in the growth or the anagen phase, and roughly around 10 to 15% of the hair is in the falling or the telogen phase. So in telogen effluvium, what happens is the hair falls from all over the scalp and it is not confined to just one particular area. So certainly the person, when taking a bath or while combing the hair, see hair falling off in clumps. The telogen effluvium usually starts 3 months from the onset of the underlying cause which causes the hair loss, and it may persist up to 6 months if the underlying cause is corrected or the patient recovers for that illness. However, even if it persists after 6 months, you are supposed to undergo medication and treatment from a dermatologist, and you may even undergo long-term therapy to get back the hair that you have lost. Let's also discuss anagen effluvium. Now, anagen effluvium is a condition where people who are mostly undergoing chemotherapy, the potent and the fast-acting medication not only kills the cancer cells but also kills the hair cells. So what happens is that suddenly the person loses the entire crop of hair. However, once the chemotherapy stops, the person usually grows back the hair. You can always visit us if you are suffering from this condition, and you can always wear a patch as you are undergoing the chemotherapy so that the baldness is not visible, and later on, with the help of medication and treatments, we can help you get back the hair quickly as soon as possible. Alopecia areata is an autoimmune disease wherein the immune system of the body, namely the WBCs, attack the body tissues including the hair follicles, and it leads to prompt and sudden onset of hair loss, which is basically in a patchy area, coin-shaped areas. And it can be present in the scalp, it can affect the eyebrows, the beard, or even the body. Alopecia areata warrants prompt and immediate onset of treatment. The treatment can be in the form of topical steroids or injectable steroids and various other treatment modalities. And the idea here is to both arrest the progression of the treatment and also ensure that there is easy and subsequently fast onset of hair growth from the areas where the hair is being lost. The treatment here might be long-term, persisting up to a year or two, because the lesions that heal up may again recur. So it is always advisable for you to be in consultation and be in follow-up with the clinic from where you're getting the treatment done. In scarring alopecias, the hair is lost in patches from the scalp, and it is usually associated with redness, itching, inflammation, and sometimes even swelling. The examples of scarring alopecia could be lichen planopilaris, discoid lupus erythematosus, dissecting folliculitis of the scalp, folliculitis decalvans, and frontal fibrosing alopecia. These conditions usually require medical intervention, and surgical intervention is not really an option in these cases until and unless the person is entirely off medication and the disease progression is arrested for at least a period of 1.5 to 2 years.